Good morning. My name is Anabel Euan. I'm a spine surgeon and I'm a spine surgery fellow at the Instituto Nacional de Rehabilitacion in Mexico City. Thanks for the invitation. I'm going to present to you my research that is titled 3-Level Anterior Cervical Decompression and Fusion with PICC Cages. It's a review of the clinical and imaging outcomes. The acknowledgements to the spine surgery service at the Instituto Nacional de Rehabilitación. The disclosures, the author and co-authors do not present any type of conflict of interest, nor with the research or this presentation. Our introduction, as we know, the cervical myelopathy is defined as a damage to the spinal cord due to degenerative changes in the cervical spine, such as facet hypertrophy, ossification of the posterior longitudinal ligament, and degenerative disc disease and osteophytes. It's the most common cause of spinal cord dysfunction in patients older than 55 years old. Therefore, its understanding and opportune management is important. The principal symptomatology, it's neck pain, clumsiness, and loss of control in the hands, sensitive and proprioceptive changes in the upper and lower extremities. Our diagnosis is confirmed by the X-ray and the MRI. As we know, the surgical procedure is the election treatment. The main objectives are decompress the spinal cord, decompress the nerve roots, and maintain the spinal stability. The optimal surgical approach and the techniques remains controversial. The anterior cervical discectomy and fusion is a common surgical procedure to achieve decompression of the neural elements of the cervical spine in different types of diseases, such as degenerative, trauma, or tumors. This technique has become the most widely used surgery to treat degenerative disc disease. In order to standardize the interbody fusion and technique and eliminate the need to take autologous graft, cage made of different materials were developed. Among the different biomaterials, PICC cages are biocompatible, radiolucent, and have a modulus of elasticity similar to the bone. It helps us maintain the spine biomechanics. It has a lower rate of complications. Talking about the approach, it is a minimal dissection through natural anatomical planes. It gave us a clear and direct disc resection, and we have a quick postoperative recovery of our patients. The clinical presentation and natural history of this disease is variable. However, due to the neurological impairment that these patients present, the need to promptly recognize and manage this disease is essential. That's why we developed this research in the spine surgery service here in Mexico City. Our material and method. In this research, we review the clinical and imaging outcomes of patients who underwent 3-level anterior cervical decompression and fusion with PICC self-locking cages with a 12-month follow-up. The data was collected from June 2014 to May 2018. It's a single-center case series. It's a longitudinal, prospective, and prospective clinical study. Our clinical outcome was assessed using the visual analog scale, the neck disability index, the modified Japanese Orthopedic Association scale, the NURIC score, and the SF36 score. The radiographic evaluation included the cervical lordosis, the vertebral body height, and the disc height. Descriptive statistics were carried out for quantitative variables through measurements of central tendency and dispersion. As a summary of what we did here in our spine center, we took all our patients older than 55 years old who had a diagnosis of cervical spine stenosis in 3 levels. We collect our data for the clinical scores and the radiographic measurements. They went through the ACDF surgery, and after 12 months, we collect again the new data of clinical scores and the new radiographic measurements, and we have our final data outcome. In our results, we have a record of 21 patients who underwent 3-level anterior decompression and fusion with PICC cages. We had 11 females and 10 males. The age was an average from 66 to 76 years old. 8 of our patients had a diagnosis of myelopathy. The most frequent levels of intervention were C3, C4, C4, C5, and C5, C6. An anesthetic time, it was an average of 253 minutes, a surgical time of 196 minutes, and a surgical breathing of 142 minutes. In our results, we had pretty significant results, especially for the modified Japanese Orthopedic Association scale, in the neck disability index scale, and in the cervical and reticular visual analog scale. In our radiographic variables, the most significant results were for this height, especially in C4, C5, C5, C6, followed by C3, C4 that were the more intervened levels during the surgeries. Here we have an example of a patient who went through surgery of ACDF in our service. In the left side, we can see a preoperative anterior posterior and lateral X-ray of the cervical spine. We can see here the subchondral sclerosis, the anterior osteophytes, and the decreased multi-level intersomatic spaces. It evidenced the diagnosis of C4, C5, C5, C6, and C6, C7 cervical spinal stenosis, and the postoperative anterior, posterior, and lateral X-ray of the cervical spine in the right side of the cervical discectomy and fusion in 3 levels with self-locking cages. In our conclusions, we know that the 3-level anterior cervical decompression and fusion with PEEK cages showed improvement in radiographic parameters as well as in clinical scores. The cervical lordosis is preserved and the disc height is improved. It shows a significant decrease in pain and an improvement in our patients' quality of life. The multi-level ACDF with PEEK cages is currently one of the most used techniques with significant clinical and radiographic results. However, more studies must be carried out to allow us to improve this technique and avoid possible complications. Actually, we are developing in our service, along with another institute here in Mexico City, a new research where we are trying to find the best self-locking cages to avoid one of the principal complications, that is the subsidence, as we all know. So I hope I can share this with you soon. Here are our references, and that's all. Thank you very much.